I think that's us going to start now. Hello and welcome to today's Sport and Exercise Medical Science BSc taster session. Thank you very much for joining us. My name is Niyati and I'm a recent Sport and Exercise Medical Science graduate and your chair this afternoon. So we're hoping this taster session will address those course-specific questions you may have and help you gain an insight into what it's really like to study on our program. So this afternoon, our speaker, Joe Warwick, will introduce you to some of the great science and medical topics that you would learn as a part of this undergrad course at UCL. Joe will also provide a summary of the program, and there will also be a Q&A session for the second part of the event. So we're here to respond to your questions, so please share those through the Q&A function on Zoom. And this session is being recorded and will be made available on our website following today's event. So now to introduce our speaker, we have Joe Warwick. Joe is a lecturer in Sport and Exercise Medical Science at UCL within the Division of Surgery and Interventional Sciences. His academic interests center on advancing research careers in the domain of tactical athletes, with a particular emphasis on firefighters. So he's just an example of one of the many amazing teaching staff that are a part of this program. So I'm going to hand that over to you, Joe.
Thank you very much for the lovely introduction. So I thought it'd be a nice way to start by kind of briefing you about the program and who the team is first, because that makes a lot more sense in my opinion, and talking through who we are, what we do, and what we deliver so that you get an idea of what the Sports Exercise Medical Sciences program actually looks like and how to get onto it, and then giving you a snapshot of a module from year 2 and how that leads into some of the modules in year 3 before we open up to a Q&A. So you've got your Q&A tab. Please feel free to fill it up, lots and lots of questions, and we'll get to that towards the end. So the program team itself is run by a lot of specialists and has been expanded over the years, and the overall arching program is run by Flaminia herself. She's exercise physiologist who specializes in neurophysiology and neuroscience. She's doing a lot of really cool research on brain health and brain activity for physical activity. Paul Fawley is a specialist physiotherapist in the team. He's been an absolute unbelievable world-class level of physiotherapy for 30 plus years. Prior to that, he was in the military. So a massive wealth of knowledge, especially when it comes to working with athletes, injury assessment and rehabilitation, which is one of the big parts of the Sports Medical Sciences program. You've got myself, so my background is actually strength and conditioning. I'll go into myself a little bit more on the next slide. Newest member to the team is Kate Bradley. She's an exercise physiologist that specializes in women's health. Recently published some really good stuff around kind of training and the menstrual cycle. Doing lots of research at the moment into menopause and women's health as well. Dr. Nathan Ryden, whose specialist area is cardiology. He does loads and loads of cardiovascular science work with elite level athletes and teaches across all the programs we run. Dr. Tarun Desai is another exercise physiologist with a specialist pathway down nutrition. He's done loads of research in nutritional supplementation and stuff. Runs the sports optimization, work placement, and a couple of other modules. And then we have I think 4 administrators now across the course, 1 for each level. Pallav is currently on the slide, but he'll be back. Should you join the program, he will be the go-to, but at the moment he's doing some maternity leave cover for another program. So a little bit about myself so you can get some context as to where I'm coming from. So I'm a lecturer in sports exercise medical sciences at UCL. I'm only part-time with that, and my full-time job, I'm actually a firefighter in the London Fire Brigade. But my academic background started at St Mary's in Twickenham, where I did my degree in strength and conditioning sciences, and then I did my master's in sports medicine and exercise and health at UCL. So I was a student before I became one of the lecturers. I worked in research projects with the University of Bath, and we did some research in the fire rescue services after the back of Grenfell, looking at thermoregulation and physiological strain of high-rise firefighting tasks. And I was part of the process that changed national operational guidance for turnout times and protection of the public with regards to firefighter response. That bottom left picture is actually me in training. So I am an operational firefighter. That was a training venue we went to last year. Pretty cool, up Morton on the Marsh, which is Oxfordshire way. And we was doing some stuff on tactical ventilation, a little bit off piste, but it's always nice to know you've got people that are working with you and that are not only theoretical but have that applied background. I worked with the English Table Tennis Association as a strength and conditioning educator for their team. I worked with London Wasps as a strength and conditioning coach for the academy squad. And Hampton School, I ran their rugby strength and conditioning for a small period. And then I was head of physical performance for Chelsea Football Club, running the S&C for the women's department and running the integration of medicine and performance, so the rehab side of things, for the men and the senior boys academy. So, like the under 21s academy within the football team. So, I was working with some really, really cool guys there and bridging that gap between performance and medicine. My research background is with tactical athletes. So, I've worked with the Metropolitan Police, I've worked with the counter-terrorist firearms officers, and I'm currently working with the London Fire Brigade alongside my operational role to develop my PhD in cardiovascular strain and operational readiness in the fire brigade. So looking at that acute ECG response to see what's happening at the heart, because we know cardiovascular disease is a massive killer in the fire service. But not just that, we also know that there's observable changes in the electrical physiology of the heart and also the structure of the heart if you was to assess firefighters over periods of time. So that's me, that's my context and my background. Um, I'm one of the. I'm only a part-time member of staff, but that gives you some idea of the breadth of experience and knowledge I bring to the program, just across a small element of it. Everyone else has, got similar levels, if not more, of exposure to huge amounts of research, education, experience, practical application, etc. And we're all bringing it in to develop the medicine program or the sports exercise medical sciences program continually and adapt it and grow to the needs of the students. So, what is sports exercise medical sciences? Well, it's medical sciences, sports sciences, and scientific research all combined into one beautiful package. You start off in your first year and you're looking at doing more of the intercalated medical sciences modules, and it essentially looks like first year of medical school. And then as you go through second and third year, you end up doing more and more sports related and get more options to pick. So we've changed it now since Niyati graduated. We've actually got more optional modules where you can pick and choose and kind of carve your own little pathway through your education. And then finally, you would do a large research project within your third year. How did you get into this course? So application goes through UCAS, obviously, and you would apply through a normal route, really, but you need 3 A levels at a grade A, I believe. I'm pretty sure this is the most up-to-date page. But if you're unsure, check the Sports Exercise Medical Sciences BSc for prospective students on the UCL website. It's quite a competitive application process now because we have limited numbers. We have a capacity of students we are allowed to take. So, and we've found year on year that there's been more and more and more applicants because the program has grown in popularity, which is fantastic. Regarding any international or other qualifications, I'm not quite sure. You'd have to email the administration and department for that. So how does the actual program look? Now, I thought it would be better to show you it this way than to actually go into the teach first. Year one, you're doing a lot of foundational medical sciences work, lots of stuff with the IMS department, so the integrated medical sciences. And then you do a couple of small elements with us. So you'll do a cardiopulmonary exercise physiology with Kate, which is a small course which covers, I think, about 6 weeks towards the end of term 1, maybe term 2, depending on how it's manipulated. I think it's term 2 now. And it will be a small course that will specialize in some of the kind of elements of fitness with regards to VO2 max and how energy systems work. You'll do practicals in that session as well, and I will do an introductory S&C lesson as well, really, really basic. You'll then do a really interesting functional anatomy and medical imaging short module with Paul as well. And there he talks about like the biomechanics of movement and how the body actually does things in multi-planes, and then starts thinking about the medical imagery side of things, so the MRI, scanning, ultrasound, those elements, and it teaches you how to start thinking about the body in movement and how these scans can be used to understand what forces are going through the body, what the tissues are doing, and how the tissues adapt whilst you're looking at different movement patterns, etc. Year two has slightly been adapted, so you will do more sports-based stuff now with us. So you've and an applied physiology one. There's also that applied physiology. I'm going to give you a snapshot. Is a term two module. There is also a one that I didn't put on here, unfortunately, is a cognitive sciences module, which is all about decision making, and that is now mandatory and is run by our SEMS department. So you get an integration into the sports medicine right away from kind of term two in year one, and then it feeds across more, and you start doing more and more and more sports stuff as you go through. We also run the infection immunization and repair module at the moment. That is an IMS one, and then we highly recommend nutrition and metabolism if you want to do sports nutrition, but that is slightly external to us as a department. Year three is the kind of big year for everyone. Lots of work being put in to your research project. You have optional modules this year, which include a work placement or sports performance optimization, exercise neuroscience, or exercise medicine. So you can pick and choose. There's, I think it's 3 or 4. And then we have made a big decision to integrate the tissue healing and rehab and the sports injury assessment management into one big continuous module across the 2 terms to make the process seamless and the assessment criteria, the assessment flow a lot better. So you end up with less assessments. They're slightly weighted more, but you get a much better understanding of the flow through it. So the whole idea is that in year one, term two, we're starting to lay down the foundations of what sports medicine, sports medical sciences looks like. You will do loads and loads of medical sciences work and then little bits of sport with us. Year two, you'll do significantly more sport with us, and we will start building on those foundations. And then in the applied physiology, I will go through a lot of the structure of training programs and why you do it the way you do it, so that you can understand how to put together rehabilitation programs. Year three, you'll learn how to assess individuals and how to then take what you've learned in year one and two and put it into practice so that you can start helping individuals. It's really good because it is quite a broad degree, but it does narrow off. And it opens up a lot of doors for further education. We've had people go on to study medicine. We've had people go on to do PhDs in cardiovascular sciences. We've had people go on to do pre-reg master's courses in physiotherapy. And, you know, it's one of those courses that itself lays a lot of really solid foundations for you to go and specialize in a lot of areas. And it is quite intense. And we have quite high expectations of students at UCL. So it's a really good course to work on as well, because the students generally are very, very good. So a quick snapshot then. So year two, applied physiology, my module you'll do with me. So we start looking at the actual physiology, the muscle physiology and neuromuscular physiology. So we're starting to look at how we can bring elements of our theoretical phys into our actual application and how we put it into place in the field for athletes, for patients, for general population. Some really cool elements and stuff we actually discuss as principles for training. So we start to look at how and why we may do some sprinting work or some strength work, and we start looking at how we can structure what we do to give the best adaptation for a healthy individual. And then we look at how in year three we can adapt that for a individual that's got some sort of sports injury or, you know, clinical condition, and how we can bring these principles in play. So something we want to consider is a really, really simple principle of kind of strength and conditioning and applied physiology is the principle of overload. So overload is about the continual and slow incremental increase in the stress that's placed on the body to get an adaptation so that you can supercompensate and develop a better kind of higher level of homeostasis. From ground zero up, you want to build up. If we think about the theory of Milo of Croton, the old Greek mythology, When he was a boy, he had a baby calf. He would put it on his shoulders. As he grew to a man, the calf grew bigger and bigger. That's the kind of real basic concept of um, overload. We then look into the science behind it and start discussing some of the theories that have driven some of our sports science and sports medicine application for the last kind of 40, 50 years, if not slightly more. So we've got the general adaptation syndrome, which is the grey and grey graph with the red line. We look at, okay, if we want to elicit some sort of stress, we want to put a training stimulus onto someone, we know that causes the body. So think about DOMS, think about fatigue, think how tired you sometimes get. We know that causes the body to drop into an alarm phase and we need to recover. That recovery then allows for us to go through our resistance phase and super compensate to get better than we was before. Really simple example of this. If I know my back squat 1RM is like one repetition max is 100 kilograms, if I elicit a training stimulus of 95% and 95 kilograms, I will hit that alarm phase because that's a high stimulus. I'll need to recover. And then once my body is super compensated, if I was to retest it again after sufficient recovery, my 1RM would probably have crept up slightly, somewhere to 105 maybe. So if I was to do that same stimulus again, exactly the same reps, same sets, same weight, it wouldn't be a greater training stimulus. So I need to think then, okay, next time I do it, do I do one more rep or do I do 97.5? Or how do I structure my overload? We then discuss other theories of fatigue as well and how this can manipulate or be manipulated by training, or how this actually has a massive impact in the way we structure our training across the week. So we might think of the fitness fatigue model. So the overarching kind of theory behind this, taken from psychological sciences, is that fitness as a kind of concept doesn't actually reduce when we're fatigued. What happens is our performance drops down. So because of fatigue, because of what fatigue does to our body, so it closes down some certain muscle activation patterns, it slows down the way signals go from the brain to the actual muscle itself to cause a contraction. Well, our performance is reduced, but our fitness itself hasn't changed. So we discuss how and why this is applicable to our gym training, our speed training, our conditioning sessions, and how we can then start to think about implementing this in our rehabilitation programs in third year once we've done our assessments and we know what we're doing for putting together sessions. Once we get an understanding of the theory and the other principles, we start looking at what's called periodization. So this concept of training organization. How do you put training together according to the months, years, and competitive schedule and calendar that you've got? So periodization is like I like to keep it really, really simple. I'm a relatively simple man. I like simple things. I bring it back to food. So periodization is like a recipe card. If I was to make a lasagna, I know that when I make my lasagna, I need pasta sheets, I need white sauce, tomato sauce, meat, or however I want to do it. I know that I've got these constituent parts that need to go into that recipe to make a lasagna. That to me is the overarching bigger plan, bigger picture. These are the four things that goes in. Once we start breaking it down to suit my tastes and we individualize it to the athlete or the rehab, we're breaking it down to more meso, which is like goal phases. So you might look at that as the actual meat layer. Okay, what kind of meat do I want? What percentage of beef versus lamb or pork or whatever? How do I want to make it? And then we break it down into the micro. It's like, okay, daily and weekly training. What's the salt and pepper content? Really seasoning it so that we can actually structure this to taste exactly how we want it to taste, because everyone will adapt differently to the same stimulus. Nobody out there will get this exact same adaptation as you or me if they did the same training program. So understanding all of these principles and how to apply them is part of the bigger picture of periodization and allows us to develop the theories, develop the ideas, develop the structure to actually train people, whether they're professional athletes or injured old, old ladies like Miss Smith fallen down, broken a hip. It allows us to put these principles in place to help her or help whoever it is get significantly better over time in a very, very structured manner so that they don't get injured again and or we minimize that risk, because we can never say never. We start putting on the applied physiology as well. We start putting theory into practice with regards to the way we talk about functional movements, the way we talk about testing. We use force plates that, we give demonstrations on force plates to show how we might measure someone's systematic strength, how much force they can put into the ground, whether they can do a big old pull or whether they can do some really high jumps. Apologies. And then we actually look at, okay, we know these are the principles, we know these are the underlying areas we want to work on. If we test these within an athlete, what does our athlete have? So we build a needs analysis, and then we build a testing battery to know where our athlete is and what they have, and how we can put training together or rehabilitation packages together to better understand the requirements of the athlete, so that we can structure their training in a progressive overloaded fashion, periodized over a longer period of time, specifically to their needs according to the tests we do. We've got some really cool kit. We've got some Hawkins dynamic force plates as one of the many pieces of equipment we have in the lab that can show us hundreds and thousands of lines of variables that we might want to look at. But keeping it quite simple, if we was to look at peak force or rate of force development, we could structure our testing battery for the individual, and we discuss these ideas to the injury that's occurred to them. So if it was, for instance, a football player with a hamstring injury, we might do a long lever isometric hamstring bridge, and we might look at how much force they can drive down into that force platform using their heel, so really trying to get that hamstring curl going. And we compare that left to right to make sure that they're developing the strength qualities that they need to start considering moving on to the next step of training. The next thing we would do is look at specifically their rate of force development. So how quickly they can go from 0 to maximum, and how long it takes them to do that left to right. Because we know sporting actions generally take 200 milliseconds if you think about striking, punching, kicking, jumping, throwing, those kind of things. So if we've got a left leg that's uninjured that does a contraction in 200 milliseconds, but a right leg that was previously injured but does that same contraction, gets the same force, but it takes 400 milliseconds, well, we know that there's some sort of delay and some sort of other problem that we actually might want to consider restructuring our training to meet the needs of that specific contraction type there, so that we can speed that up, get the rate of force development up, make them essentially more powerful and more robust. Now, that's a lot of stuff we do in like year 2, thinking about the applied physiology. When it comes to year 3, we look at principles of tissue healing and rehabilitation, and we've combined this with the rehab and the assessment modules all be one module now. So it's a really nice structured module. And we start to look at actually what's the structure behind this? What's the purpose? What's the principles? And how do we start to think about training and overloading these athletes in a way that will give them the optimal recovery and get them back to the optimal performance? So we go through really simple foundational science around wound healing, tissue healing, and bone, etc. And then we go into some more specific work around how we might actually assess specific joints. So not only are we trying to understand how and why things heal, but we're also trying to understand from a anatomical perspective where the problems are and how we can get hands on to actually make sure we've helped guide their rehab in the best possible way. So Paul Fawley, one of the teachers on this program, 30 plus years as a physiotherapist, has 100% the best teacher. He was one of my teachers on the masters as well. 100% one of the best teachers for teaching you hands-on skills and qualities. And we've had students go on from our course and start orthopedic rotations, and they're miles ahead of other orthopedic students because they know how to do a anterior draw test. They know how to test someone's hip integrity. They know what a what a specific like empty can shoulder test is. They know the specific tests and they've learned them. And this all forms part of the package and plan for developing and understanding the whole rehabilitation structure and process. So a couple of the assessments that are done in third year are OSCEs, so objective structured clinical examinations, and you will be assessed on your ability to perform these tests under a slight bit of pressure, not typically loads. It's always uncomfortable when me and Paul are standing there staring at students, but they they will have a volunteer in front of them, and they will have a scenario given to them, and they will go through a specific battery of tests, and we will ask them for their top three differential diagnosis. So if we've given them a scenario around a knee, they'll then assess things like gait, so walking patterns. They'll assess whether they're standing, offloading. They'll ask questions about bits and pieces. It's normally more the objective side. And then they'll test we'll test their knowledge on the specific tests that they're doing and tell them whether they're positive or negative. And then they come back with their answer. So they might get three positive knee tests, and then they have to say to us, oh, we think it's potentially an ACL, a meniscus, or an MCL. And they come back with the top three differentials. Now, a lot of the stuff we do in this, we don't overemphasize you knowing the test name and the sensitivity and specificity, but we want to know that you can get hands-on and show us how to do it because you've learnt the anatomical structures and you know how those anatomical structures work. That's really, really key. So learning how and what the ACL does, for example, making sure there's no, anterior shift, making sure that when the knee's actually doing its roll and glide, you know that it gets in a slight bit of rotation. Well, if you can know and understand this, then you can work out quite quickly how the tissue gets damaged or how the structure itself gets damaged. So that's a lot of what we do in this module is go through foundational areas of tissue and wound healing and or functional kind of anatomy elements and how to get hands on with that. One of the other parts of it is being able to actually structure. So this was slightly different, but being able to actually structure and put together your processes and thoughts on how to rehabilitate a injured individual. So what we've got here, if you can look across the top, is so this is a fictitious ATFL, so ankle ligament, grade 2 ligament injury. And this is just something that I've put together to give you an idea of scope of how you might structure it. So this is us putting together the post-surgery weeks across the top, understanding the tissue healing phase or having a kind of idea of where they sit within that healing phase. Then if you look through, you can see the kind of rehab plan, and it's got general prep / return to training and returning to baseline. And it's got each week kind of laid out, and emphasis is on what we might do and how we might structure it. So for example, really early on in the rehab phase, which will be 6 weeks post-surgery, week 1, they come and see me as their S&C coach. I'll be massively focusing on, range of movement, stability, with a small amount of focus on strength, absolutely nothing on ballistic and jumping work, no plyometric work, huge amount of work on gait re-education, and understanding that all of the principles that we put into place are built around how we can process every other different element into a plan like this so that we can give them a structured return from the physio bed or the surgical table back to performance. And then we'd like to discuss areas of evolution through the training process. But it's never static. You always want to plan with an open mind and in pencil. So we talk about our testing battery as well as an evolutionary process. Testing battery at the very, very beginning will be very different to at the end, but that will drive our key performance indicators and help us to understand that the athlete or the patient or whoever we're working with is actually on the process, along the right process in the journey to take the next step and do the next bit. And then bottom right, I've just got a kind of structure of how you might want to think about adding some strength and conditioning components into this particular piece of rehab. So this ankle rehab, weeks 1 and 2, really, really light emphasis on some strength work. And as you can see, no ballistic and no plyometric stuff. Really, really basic linear walking holds, mechanics and stuff. And we go through those so that you can understand how to structure the really simple stuff for gait re-education and then how to get back to full running and sprinting, etc. So a lot of it is about building foundational knowledge and then just expanding on it and developing and growing these structures as you go. So I've got a little bit of time. We've actually got loads of time. There's a Q&A session coming up. So if you would like to ask questions, please throw them into the Q&A section because I've done 30 minutes now of talking, and we will open it up to Q&A. I think it's nicer when you do that if you've got students with us. How many of 20 odd people on here?
I think there's a question actually.
Yep, go for it.
So what would you say is the hardest part throughout the whole course?
Okay, well, I'd like to know your opinion on that, Niyati.
All right. Well, going in, I think it was a lot more medical sciences based and kind of pushing through that first year and gaining all that foundational knowledge so that you can apply it to settings that you may be more inclined towards. Also, like the sports side of it. So I think pushing through that first year, it really pays off. And I would also say, obviously, the last year, the research projects, but they push you to learn so much. And I like if I go back, like I wouldn't change a thing. It's the hardest part, but it was one of my most favorite years. And the cohort really comes together during these projects, so it's really nice to see. Yeah. So
I think adding from a staff perspective, the hardest part is always the research project at the end.
yeah, definitely.
Getting in and then the research project at the end.
Yeah. All right. I think okay, we've got a few questions coming in.
Cool.
So I'm not sure about a few of these, more admission side, but Christian says, do you accept BTECs as in a national sport diploma or is it just A levels?
You would have to email the admissions team for confirmation, but I'm pretty sure it is just A levels. I think because they need A level in chemistry or physics, one of them at least.
Yeah. All right. Well, I hope that answers your question to some extent, but I would also just email. So Amraj says, is it a sports medicine degree and a sports science degree the same thing?
No, no. So sports medicine degrees. So this is a sports medical sciences. So this is a combination of medicine and a combination of sports science. So you get a best of both worlds. So when you go into sports science, you'll do physiology, you'll do sociology, you'll do history of sport, you'll do some coaching stuff, but you won't do any clinical work, you won't do any medicine work, you won't do any of the integrated medical sciences stuff. So you won't learn about disease, about immunology, about pharmacology. You can in sports science do nutrition as well, but it's two very, very different pathways. Not to say one is better than the other, but a sports science degree is a lot more common, and there are a lot more institutes that do it. So you find that I think there's something like 20 odd thousand sports science graduates every year for sports science, whereas sports medicine or sports medical sciences is a significantly smaller field at the moment, and it's a lot more specialist in the fact that you get a lot more hands-on skills, and you get a lot more exposure to clinical kind of field. Yeah, so it is very, very different. Sports science itself is really, really broad. Sports medicine as a degree is quite broad, but nowhere near as broad because you won't do history of sport, psychology, sports sociology, that kind of stuff either.
Yeah. I would say it opens you up to a lot more clinical stuff for afterwards as well. So if
Mm,
that's what you're leaning towards, then
a lot
sports.
more.
Yeah.
For postgraduate studies as well, it seems to be really highly looked upon as a tough and kind of what's the word I'm looking for? More prestigious course at the moment. Sports science doesn't seem to have that anymore, unfortunately.
Yeah. Well, I hope that answers the next question as well. How does the career pathway differ between sports medicine and sports medical sciences?
Yeah. So sports medical sciences, you would do, it depends on what career you want to follow post graduation, but you wouldn't be a qualified physician. So you would still have to go to medical school. Whereas sports medicine, if you wanted to join a faculty of of sports medicine or something like that, as an as a medicine physician and go into become a consultant, you would have to go to medical school first and then come back and do the masters in sports medicine. Whereas this, if you did it the other way around, you could do this as an undergrad, and then you could do graduate entry medicine, which is 4 years instead of 5, 6 years, which we've seen quite a lot of people do. And then they go away and then do their faculty of medical sports medicine training after and become consultants in sports medicine.
I don't know if you want to touch on the IBSC bit as well here, or
Yes, yeah. So that's a very good point. Well done. The IBSC. So we run for for medical students. We run a 1 year IBSC, which is an intercalated bachelor's, which means that in year 3 of medical school, I believe it's year 3, they come to us for a whole year and they do sports medicine for a whole year. And that's kind of like a real condensed version of the undergrad, and the master's is really condensed down into one intense year for medical students. And then that opens up a lot of doors for sports exercise medicine as a speciality after they graduate medical school.
but that does, I think there's a whole application process within that. So
Yeah, that is extremely competitive.
yeah.
I know this year we've only taken eight
Oh
students,
wow. Yeah.
and no one external to UCL Medical School. Everyone's from UCL Medicine.
All right. I mean, I hope that answers your question. So moving on. If you've done biology but not another required subject, but did PE instead, would there be an option of doing it or not?
I've been
Again,
asked all by someone. I don't know. I think if you've got 3 A levels and one of them's a science, then I think and they're all at A, I think you might be okay. As
I think
long
it's
as,
usually, sorry, go on.
yeah, no, no, go for it, Niyati.
I think it's usually biology as a requirement and then chemistry, physics, or mathematics as the other ones. But I'm not too sure about this because it's very different from when I applied.
Yeah,
Um, but speaking from what's useful or helpful to get you through when you do come in, the first year is a lot of biochemistry and physiology. So I would say having chemistry is extremely
yeah,
helpful, but I don't know if it's required. I think Kate's put something in the chat if anyone needs. Yeah, there we go.
yeah. I've just gone back to the slide on entry requirements. I think biology is a must, and either chemistry, maths, or physics are required. So one of the other three. Um, So yeah,
Yeah.
again, there is that contextual offers option, but again, I would email admissions if you're unsure.
Mhm. Okay. So what are the jobs that could lead after this course?
Hmm, really good question. So we have students that have gone on to become physiotherapists. We have students that have gone on to go and study medicine to become medics, doctors. We've had students go and do master's degrees in strength and conditioning or physiology, or become strength and conditioning coaches, become physiologists. We've had Ellen, she went to do her PhD. She went straight from the undergrad to do her PhD in cardiovascular sciences at Imperial. Um, we've had people go into politics. We've had people go areas you can go into. Have I frozen?
Yeah, I think the Wi-Fi's acting up. Can everyone hear me okay?
Yes, Niyati.
Okay. Well, I'll just pick up the question while Joe comes back. Oh, all right. So if I'm still connected, can someone just confirm that I am?
Yeah, you're still connected.
Perfect. But yeah, to just complete the question, there's so many jobs that can lead after this course, and I think the best part is discovering them as you go along as well. I came in with a very clinical focus, and as I went through the course, that shifted to more of a research angle. And I think the best part of studying at the ICH, or the Institute of Sport Exercise Science, gives you access to a broad range of clinicians, but also like people in research. So I hope that answers your question. But to summarize, you can go off in to do clinical research or exercise physiology, work with sports teams, continue to graduate medicine, do further studies, and yeah, the options are kind of endless here. All right. So the next question. All right. So the next question is, how long was the research project? And I think I may wait for Joe to answer this question, but from my personal experience, it depends on the project that you choose, but it runs throughout the whole of the third year. So from September all the way till June. So you pick your projects in the summer, write your proposal, and if you get accepted onto that specific projects, you meet with your supervisor, and then it goes from there. But it really depends on the scale of the project. So it starts from recruiting participants if that's required, or if you choose a data project, learning how to code and exploring that. So it really depends on the project you choose, but I can say that it is a taxing experience, but in the best way possible. So it really depends on how much you take on. So Joe, the question is, how long is a research project in the third year?
Yeah, sorry, my whole computer froze for some reason. So your research project starts at the beginning of term one and it runs across the whole year. And it's very much dependent on how much time you want to put into it, really. We do lots of different research projects across all of the members of staff. So you essentially join one of our teams and we will guide you through the process. And we do lab-based research projects and we do database research projects. And there's a lot going on. But it's now I think it's now a 30 credit module. So the expectation is 240 hours of input across the two terms. And that includes assessment time and other bits and pieces. So if you think about every single module as a minimum of 15 credits, well, for 15 credits, they expect 120 hours of input. And most of that is self-learning. Most of that is done by yourself. So if you've got a double credit module, then you're looking at 240 hours minimum. For instance, the applied physiology module is a 15 credit module, but you'll spend about 40 hours, maybe 50 hours with me, and then you're expected to do the rest yourself. So there's a lot of onus on independent learning at UCL, and that's across all of the programs.
Yeah. And I would say if your aim is to succeed in that project, it really depends on the amount of time that you put in. But also, you don't have to force yourself to do it, because I can guarantee that the project that you choose will become like a part of your life for the year that you are working on it. So I wouldn't worry too much about that.
You always find that the students that do pick a project that they enjoy, they spend more time doing it, they understand it a bit better, and they tend to get the better marks, the higher two ones and first. Those that pick a project they don't enjoy or an area that they don't enjoy, they struggle. And yeah,
I hope that answers your question. So Natalie says, what would you do to strengthen an application to this course?
Oh, that's a good question. Meet the base requirements, but I would do some sort of work experience or get some experience in different fields to understand what different clinical fields look like, as well as different applied fields. So potentially doing some shadowing or some observation of a physio, of a doctor, of a sports scientist, a coach, something like that would, I think, make your application and your personal statement stand out. And it goes a long way. I think if you can continue to do that through your studies as well, it goes a long way into applying for a job or applying for postgraduate studies. Because yeah, the more experience and exposure you get, the better, in my opinion.
Yeah. I would say when I applied, the thing that I felt like made me stand out was reading. like having done a lot of reading in the space and just knowing information regarding the subject rather than just like the observational or the theory stuff that you learn in school. Okay, so what are the 2 phases in which admissions are open? Again,
No idea.
yeah, this not sure.
I'm really sorry. Kate might be able to answer that in
Yeah.
the comments. I have absolutely no idea, I'm afraid.
Yeah, we'll just move on from that and hopefully you get your answer soon.
Yeah, you
But
should be able to find it on the website, for the admissions website. If you go to their FAQs, they generally have these kind of frequently asked questions. They generally have answers for them. And if you can't find an answer for it, there will be an email address for you to go to.
yeah, definitely. A few more admissions questions. So how can I book my admission from UCAT? Again, I'm not too sure, but I know all applications go through UCAS.
UCAS.
And you'll be able to select the university and the course with a code, I think, if I remember correctly.
Yeah. Yeah. So this you apply to this in a typical way you would any undergraduate course, and that's through UCAS. UCAT is a entry exam that's required for medical school. You don't need to do that for this program because you will have to do medical school before or after if you wanted to be a doctor. So this isn't medical school. And to become a doctor, you would need to go through a traditional medical school route. Those applications to medicine actually open up very early in the academic year, and they need to be done generally before the 1st of December. I think they're even earlier than that.
For
So
medical school, yeah.
yeah, for medical school themselves, they are very, very early applications. So if you're in year 1 of your A levels, start looking at it now. If you're in year 2 of your A levels, you're probably going to miss the boat if you don't apply very, very soon for medical school.
Yeah. There was another question about the UCAT, and they say, how did you revise for the UCAT? So again,
so UCAT itself is there are study materials that you can purchase. So there are online courses, there are other bits and pieces. I didn't sit the UCAT. I actually applied to St George's for medicine when I had graduated from St Mary's and decided not to go and study medicine, but decided to do this master's instead because of family commitments. We ended up having a baby quite young, so I got married quite young. So medical school ended up not being a path for me. But the UCAT then was a 2 hour exam. It wasn't too bad. When I looked into it, but I sat the GAMSAT, which was horrendous. That was a 6 hour exam because I was a grad and applying to study grad med. But yeah, again, UCAT itself, I've heard some good things about it as an exam. It's not too challenging. I don't really know how that's changed from now. But in the chat, there is a UCAS deadline 26 entry, where you can find that there. Let me just click on that and see what it says.
okay, so I'm just gonna quickly run through the other questions so that we cover everything before. How can we get full scholarships? Again, an admissions question. Although I'm sure
I
that
don't really know about any of the. I know there are academic awards that can be won, and you get those for within the faculty or division, and that's generally done each year. Someone will be nominated forward for that, depending on their grades, etc. But with regards to scholarships, it doesn't. I'm not sure the UCL run in the same way that American schools run. Well, no, they don't. I'm not sure what the scholarship packages look like. You'll have to go through the UCL main website and look down their scholarships to see which ones you potentially are eligible for. Most of them are done on academic merit. They tend not to be sports based, and they tend to be done on. You can get some for if you've got if you're first time in your first member of your family to get a scholarship, or if you've got some sort of kind of what is deemed an underprivileged background. I know when I went to university, I got assistance because I didn't come from a very wealthy background. I don't know what other scholarships there are. If you're an international student, fees are significantly more than if you're a home student. I do know that. So if you want to, again, Kate has thankfully put some bits in the chat. So please make sure you have a good read.
A similar admissions questions about Indian students and the requirements. Again, I would look through the prospectus page depending on the qualification you're doing. So if it's A levels or IB, I would look through that because I'm not sure. I did A levels, so it was pretty straightforward for me in terms of finding the information. But I'm sure everything is on the links that Kate has shared through the chat. So
yeah.
Okay, so what jobs could I go into without doing further study after this degree? Which is a really good question.
Without doing further study. So it really does depend. There are loads of graduate jobs out there, aren't there? So you can go into pretty much any field that accepts some sort of graduate training program. So I know people that have gone into the police, into private sector, into pharmaceutical sectors, etc., because they have graduate schemes. So you don't have to go into further training. Of course, you don't. You can go straight out and work. It really does depend on what you want to do, and how much you want to look into it.
Yeah, but I can say this course opens up a lot, and I feel like when you leave, you really have skills in so many different aspects, which you can kind of shine on when you're applying to different roles, which may not correlate with each other. So I wouldn't worry too much about that.
Yeah.
Okay, so we have a few more questions. I'm gonna just zoom through them quickly. Is there a PhD in sport and exercise medicine?
No.
Yeah.
No, there isn't. PhDs are generally in specialist areas of like cardiovascular sciences, or you can join the department and be a PhD student within the department, but it's in a specific area. There isn't like a sports medicine PhD overall. I know I know some people have claimed to do a PhD in sports exercise medicine, but it doesn't. No, sports exercise medicine is far too broad. PhDs are really narrowed down to specific things. So they generally are. So you think about your pyramid of your academic career. Your undergrad is very, very narrow. Your master's starts, sorry, very, very wide base. Your master's will narrow you off to more of a speciality and a skill, and in your PhD, you become a specialist in a very, very narrow field.
I mean, I feel like in any field, PhDs are just very narrow. You're looking at one question for 3-4 years. So yeah.
Yeah.
So do students have access to all the testing and facilities at the ICH?
You would have access to the labs and to the seminar rooms and other spaces in the teaching facilities. Yes, 100%. So we have the whole of the first floor, and yeah, there's during working hours you can use it, but under supervision of staff. There are other great facilities around UCL as well, so study spaces, libraries, things like that. You won't want to be at the ICH the whole time, but yeah, you can get in there.
Okay. Could you go into nutrition or dietetics through this course and not medical school?
Yeah. Yeah,
Yeah.
if you was to do the nutrition and then the sports nutrition modules, you would open up, you'd build on your foundational knowledge, and then you could go and do postgrad studies in that field and become a registered dietitian or sports nutritionist. I'm not sure the kind of technical term for that specialist kind of pathway of career and what you would need to do. I've never looked into that. I've worked with nutritionists, maybe Niyati, maybe you know a
Yeah,
bit more.
so I have a lot of friends that were in the IMS, so the Integrated Medical Science program, but the nutrition and medical science BSc. So
Yep.
a lot of our modules are shared with them the first 2 years, and then we do our sports nutrition module with them on the last year as well. So a lot of them have applied for masters in dietetics, and I've heard that it's extremely competitive. So I'm not sure if this degree would give you an edge to get into a program for master's, because my understanding of getting a dietitian license is that you have to go through the clinical master's. So I don't know if we're the right people to answer that question, but I hope this helps. Okay, Joe, question for you. Just out of my own interest, what was your role when working for Chelsea FC, and how did you receive that role?
So I was a head of physical performance, and I was in charge of the gap between performance and medicine, and making sure athletes were fit, strong, fast, healthy, and able to train, play, and perform. I oversaw the performance department, and I was paralleled with the head of medicine with regards to our kind of role and responsibility. He oversaw the medical department, I oversaw the performance department in that regard. So loads of strength and conditioning stuff, loads of sports science stuff, working with athletes to make sure that they were performing to the best of their ability. Had loads of staff under us, like nutritionists, psychologists, more strength and conditioning coaches, more physiologists, etc. I got into that job. I applied for a different job, and didn't get offered that job because of my background was more rugby. So I asked them for some opportunities, and then they gave me some opportunities, and I took them, and then I got offered a role. It was kind of, yeah, quite as simple as that. Once the initial application, they were a bit like, "Oh, we don't know because your background's in rugby." Once I got my foot in the door, I firmly threw that door open. And then they ended up, yeah, hiring me for 4 solid years. So
That's great.
yeah, good fun.
Okay, more quick questions. So Scarlett, yes, the video link, I think the recorded link will be shared on the
Yep.
website after the session, so you will be able to access it after. And again, about the A levels, it should all be on the prospectus page, everything you need.
Mhm.
So
Yeah, that's quite a broad question. Can you please explain about the A levels? Um, if you haven't done A levels, you'll need to look at what the equivalents are for you to be accepted. If you have done them, then go to the website and it will tell you which ones you need.
yeah. Okay, so I think that wraps up our time today. So if you can please provide us with your feedback at the end of the session by filling out the survey. I think it should pop up on your browser after the event closes, and we would greatly appreciate your feedback. So thank you, Joe, for an excellent session, and thank you guys for your questions. It was really nice to chat with everyone.
Thank you very much.
Yeah, have a great evening.
And you, bye bye.
Bye-bye.